One of my passions is heart care in women, and in particular this is very important because there have been disparities throughout the last several years which continue in heart disease in particular. There are many differences between men and women in both how we present with heart disease, but also with our risk factors and how we do clinically in response to the disease that we have. So it's important for caretakers to be passionate about equal care for their patients and their conditions and really understand the nuances of heart disease, whether it be their gender or race. In particular, there is a clinical paradox with women and heart disease relative to men. For a lower disease of burden of coronary artery disease, they actually have worse cardiovascular outcomes. For example, more women die from an acute heart attack relative to men. And some of this is because their arteries are smaller, but also the pattern of disease and the way we build plaque up is distinctly different. In addition, our risk factors affect us differently for male or female. For instance, males who are overweight and smoking have a stronger impact on heart disease, whereas diabetes is fairly equal between the genders. However, hypertension, physical inactivity, hypercholesterolemia or hyperlipidemia, as well as depression affect women much more often and impact their cardiac disease burden to a greater extent. So it's critical for us to understand how this goes and bears weight on each of our individual patients. It's also important to identify all of these risk factors that are very unique to women because 80% of the disease burden is actually preventable. All of these events can be preventable in 80% of our patients if we just identify their risk and work on things in a prevention-typed manner. Women generally take care of other people. This is one of our biggest weaknesses, and we forget to put ourselves first. And a lot of times we are so obsessed about getting cancer screening for our mammograms, as well as colonoscopies or our pap smears. But in essence, breast cancer only affects 1 in 7 women. It's still really, really important, but heart disease is the #1 killer of women, and it affects 1 in 3 women. We need to be proactive, both as healthcare providers and as patients, to make sure our female patients are taken excellent care of.